Hello and welcome to Pediatric Doctor at Home, a medical education channel created for parents and caregivers of children and young adults. This video focuses on supporting infants and toddlers through bouts of upper respiratory infections, commonly called colds. Colds are very common in children and are caused by a variety of viruses that get into the body from the nose or mouth. Symptoms may include sneezing, runny nose, congested nose, coughing, fussiness, decreased appetite, low-grade fever, and sometimes vomiting and loose stools. The illness tends to last for about 7 to 10 days in infants and toddlers, which is longer compared to older children and adults who typically have symptoms for less than a week. Regardless of the exact virus causing the illness, the treatment principles are the same. Let it run its course, as most children get better without any complications. Keep the child comfortable during the illness, and seek medical care if the child's condition gets worse. Here are 9 things that you can do for an infant or toddler with a cold. Number 1. Nose suctioning. Young infants, especially newborns, depend on having a clear nose to breathe because they are not usually able to breathe through their mouths except when crying. Therefore, whenever the nose is congested, breathing and feeding become harder for the little one. So, suctioning congested noses removes the mucus, allowing air to flow better through the nostrils, and the child is then able to breathe more easily. Try to suction before feeding, nap time, bedtime, or anytime the child is fussy or breathing noisily because of a stuffed up nose. You can use saline drops or spray in the nostrils to loosen the mucus before suctioning. The suction bulb works well for babies under 6 months, while manual or electric aspirators may be used in older infants and toddlers. It is recommended to limit suctioning to not more than 3 to 4 times in a day to avoid soreness, irritation, and bleeding of the nose. Number 2. Fluid intake. Children with colds can easily become dehydrated, a condition where there isn't enough water or electrolytes, that is salt, present in the body to function properly. Dehydration can happen from not drinking enough during illnesses, as well as losing fluids from runny nose, watery eyes, vomiting, or diarrhea. Dehydration can be dangerous for babies and toddlers because a large percentage of their body weight is water. So it is very important that the child stays well hydrated, even if the appetite may be decreased. Infants can continue breast milk or formula in smaller amounts as they can tolerate, but more frequently. No matter how worried you are about dehydration, do not give plain water to babies less than 6 months old, as this can lead to water intoxication. However, older children can drink water, milk, tea, broth, soup to keep their fluid levels up. Oral rehydration solutions are available at drugstores or supermarkets. They have the right proportions of salt and water and can be given to any child. Avoid sports drink and soda because of the high sugar content that can actually make dehydration worse. Number 3. Fever medications. Fever is an indication that the body's immune system is fighting off an infection. It is alright to not give any fever medicine as long as the child is eating well and playful. If the child is a little fussy, Tylenol or ibuprofen can be given as needed. Offering medications around the clock to try to prevent a fever is not necessary. Remember that ibuprofen is only given to children at 6 months old and above. Also, make sure to follow the recommended dose and time interval for each medication. Number 4. Rest. This is very important for recovery. Having a good sleep helps to strengthen the immune system, which in turn helps the body to heal faster. Number 5. Humidifiers. Humidifiers are devices that turn water into vapor, increasing the humidity in the room. Dry air irritates the lining of the nose, can trigger nosebleeds, and worsen cough. Use humidifiers overnight if you can to make the air moist and more comfortable to inhale. It is recommended to keep the indoor humidity levels between 30 and 50%. Don't forget to clean the humidifiers between use to prevent mold from growing in the equipment. Number 6. Avoid secondhand smoke exposure. Smoke from a smoldering cigarette, cigar or pipe, and even smoke exhaled into the air by smokers contain compounds like nicotine and carbon monoxide, which is harmful to children. Children living in a home with smokers have increased frequency and severity of respiratory symptoms. The best approach is to protect the child from tobacco smoke by keeping the home smoke-free. Air cleaning or increasing ventilation may reduce the concentration of tobacco components at home, but it does not eliminate it. Even if adults smoke outside the home or when the children are not at home, tobacco particles stay on the hair and clothes of smokers and on carpet and furniture, leaving the children exposed to these toxins. Number 7. Do not give over-the-counter cough and cold medications. They are generally labeled for kids over 4 to 6 years, even though there's usually no demonstrated benefit. Most of these medications frequently have a combination of ingredients that target multiple symptoms which your child may not even have, unnecessarily exposing the child to possible medication side effects. Research shows that honey improves the symptoms of a cold, but do not give it to infants 12 months and below because it can cause infant botulism. Number 8. Know when to seek medical care. Children less than 3 months old or with medical conditions like prematurity, asthma, heart problems, or a weak immune system can easily deteriorate when they have colds. So if your child is at risk, be extra vigilant and notify your child's doctor on time. Red flags in a child with a cold include the following: difficulty breathing manifested as rapid, shallow breaths, grunting sounds, flaring nostrils, sucking or pulling in of the skin between the ribs and in the neck with each breath, bluish color around the mouth or on the fingernails signifying a lack of oxygen in the body, total refusal to drink anything and not urinating for 6 to 8 hours, which would be concerning for dehydration, persistent temperature over 102 Fahrenheit, that is 38.9 centigrades, for more than 1 day, which may be indicative of a superimposed bacterial infection like pneumonia or an ear infection. Excessive sleepiness. Sleeping more when sick is normal, but you can wake up the child if he or she is still taking a nap for 3 hours straight. If the child is hard to wake up, has no energy, is staring into space, or is not responding to you, get help immediately. Number 9. The final item on this list is to help prevent the spread of colds. Keep children away from people with colds. Don't send a sick child to daycare or school. Wash hands often. Use hand sanitizers. Disinfect surfaces like doorknobs, toys, and furniture. So now you know what to do the next time an infant or toddler in your care gets an upper respiratory infection. Thank you very much for watching.